And so here is the first slide of the presentation. And okay. Half is joining. Okay. So today we are going to speak about how to deal with medication. And as for the presentation that you've prepared last week about different procedures and tests, we'll listen to you presenting this information during our third hour. So after we discussed everything about medication. So Vandana Nishad is coming. Well, and now let's have a look at this slide. Here we can see the names of different drugs and different types of drugs. And let us look at the names of the drugs which are given here, just to be sure that we can pronounce them correctly. So the names are paracetamol, cyclizine, salbutamol, aspirin, amoxicillin, then there is retinidine, chlorphenamine, and diazepam. So I think these drugs are familiar to you. They are very just popular and commonly used everywhere. And to the right, we have the types of the drugs, and we should match each drug with its type. So the types are here: antibiotic, analgesic, antiemetic, sedative or hypnotic, gastrointestinal, then antihistamine, cardiovascular, and respiratory. So if we speak about antibiotics, so which drug represents?
Amoxicillin.
Yes, this is amoxicillin. Amoxicillin. So it belongs to the antibiotic group of drugs. Then there is analgesic. So
aspirin.
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 Aspirin and what else? One more.
Aspirin and paracetamol.
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 Paracetamol. Yes. Antiemetic. 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 What does it mean, antiemetic? This is the drug.
Prevents the nausea.
Yes.
Nausea.
And what?
Cyclizine. Cyclizine is antibiotic.
Yes, cyclizine, yes. Can
Yeah.
prevent nausea. Cyclizine.
Nausea.
Okay. Then there is the type of sedative or hypnotic drugs. Sedative or hypnotic.
Chlorophenamine. Diazepam.
Diazepam, yes. And diazepam is sedative, and gastrointestinal.
Ma'am, salbutamol.
Ranitidine.
Yes, this is ranitidine.
Ma'am,
This is
I think salbutamol is also gastrointestinal.
Okay, you know better. Yes, I just agree. Well, the sixth one is antihistamine.
Ranitidine is also an antihistamine.
Okay, and what else?
I'm not sure.
Cyclizine, and this is chlorphenamine. Chlorphenamine is also antihistamine drug. Then we come to cardiovascular. Which of them is cardiovascular?
Aspirin.
And of course, which thins the blood. Mhm. And
Aspirin.
aspirin, right? And then there is respiratory type of drugs. And here we should write
Amoxicillin.
amoxicillin is an antibiotic.
Okay.
Okay, it can be also
Chlorpheniramine.
with respiratory problems. Yes, you're right. This is amoxicillin, and also this one, salbutamol.
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 Okay, and if we speak of these types of drugs, the question is, what are the benefits of each drug? I mean, if we speak about antibiotics, what do they do? How do they help patients? So antibiotics.
They help in the phagocytosis or increasing the immunity, we can say.
Yes, and fighting the infections, right?
Pathogens, yeah.
Analgesic, how do they work?
Basically help to reduce the pain.
Yes,
Pain or like
painkiller.
allergy,
Mhm.
inflammation.
Inflammation, yes, fights inflammation. And so antiemetic.
Vomiting. They prevent the vomiting and the nausea condition.
Okay, yes, exactly. Sedative or hypnotic.
Anesthesia.
Anesthesia.
Yes.
Yeah.
Mhm. They help not to feel to reduce pain, not to feel pain. Yeah. So how do gastrointestinal drugs work? What do they do?
To maintain the absorption and the bowling movements.
Digestion of the food.
Okay. Good. Yes. Then we have antihistamine.
Acidity.
I mean allergic reaction.
Sorry, allergy.
Allergy.
Sorry.
Yeah.
Allergic reaction.
Yes.
For inflammation.
Allergy, yeah. Cardiovascular.
Ma'am, to treat
Ma'am,
the
for the-
cardiovascular diseases related to some blood or blood vessels.
Yes.
Blood pressure, heart rate.
Head pressure.
Yes.
Pressure.
And respiratory drugs, what do they do?
Ma'am, respiratory
Then they affect
problems.
the yes, ma'am.
Sorry? Will you repeat?
Ma'am, they're using for treat some respiratory problems.
With lungs and bronchs, yeah.
Yeah, with lungs and bronchs.
Coughing and all.
I see. Okay, good. So you know everything about drugs. And if we move to the next slide, we can see a logo of an organization. So this is the name of the organization is Central Drug Standard Control Organization. It is in the Ministry of Health of Government of India. What does this organization do? What are its responsibilities?
Ma'am, they are basically
Ma'am.
responsible to approve the drugs. Means like sometime, ma'am, like I made some drugs for any problem. So ma'am, I goes to that CDSO office and I present my drug, and then they will approve it for use, and they will also conduct some clinical trials on that drugs, and then they give me approvals if it is appropriate for that disease.
Exactly. Yes, you're right. Okay. So, and similar organizations just exist in other countries. So they are called regulatory agencies. They approve the use of drugs. And in the United States of America, the name of the organization is Food and Drug Administration. This is FDA. In the United Kingdom, there is a similar agency which is called National Institute for Clinical Excellence, NICE. And also in Kazakhstan, the name of the agency is National Center for Expertise of Medicines and Medical Devices.
Ma'am, and DDA basically give names to that drugs, like nomenclature for drugs.
I see, okay. Well, yes. If we speak about drugs, we should also speak about generics. So you know that a generic drug is a medication which was created to be the same as an already marketed brand name drug. And it is the same in dosage form, in safety, in strength. It's the same in the route of administration, quality, performance characteristics, and intended use. The question, what are the arguments for and against making generic versions of new medicines available in every country? So what are the advantages of using generics and disadvantages? Who would like to say about this?
Can I?
Yes, please.
Ma'am, the generic drugs are mainly very low in the concentration. For example, if you talk about the skin diseases, so I personally had that generic tube. So what the concentration of the generic tube was very less, and the dosage, if we talk about, like, there are finasteride drugs and all. So in the normal, in the the companies will make it more powerful, or will increase that strength for that particular drug by 200 mg, but in at the same place, if we talk about the generic drug, then it would be only 50 mg or 40 mg. And the quality of the drugs are not like compromised, but they are taken to be care in with respect to the government hospitals, along with the local supply chain. There are many pharma companies, so they have, like, as we talk, like, as the Mohammed told, like, there is an organization, so those organizations just approve the companies for that. But for the generics, it's a bit different thing. They have, like, they are directly supplied by many, the same drug will be supplied by many brands in the companies. So for that consent, they have to take a care, and there is a in order to approve the license, they have to make it very safe, and the quality should be good, and the performance and characteristics should be very well, in order to supply it to the wide variety of local suppliers and all.
May I?
So this was
One point that
May I?
Aman has
Just a
mentioned,
minute.
that it should be cheap.
Let us listen to
That-
Priyesh first. Mhm.
Ma'am, basically, I think there's a misconception going on for generic drug. Ma'am, generic drugs are the same drug and they are equivalent. They are not less effective, or they aren't have concentration. Generic drugs are called generic drugs because these are prepared from the. I mean, whenever a drug is prepared, they do a very extensive research, and then patent is carried on that particular drug. Once the patent expires, I mean, everyone does a research. A company does a research, invest in lab, scientists, and all. So they actually sell it for a very high price, and they also put up a patent on it. Once the patent is expired, these drugs are free for other other factories and other companies to produce. I mean, they actually duplicate the drug. It isn't in that they are less effective. They are the same drug, but they have been duplicated. So cost of research and lab and all that goes down. That's why these generic drugs are cheaper, but they aren't less effective. They're same as they are same on the biovalence level now.
Why are they cheaper then?
Ma'am, because they don't. I mean, see, if I am a guy and I have to make a car, what I'll do, I'll prepare a sketch. I'll prepare. I mean, if I'm doing my homework, ma'am, you give me a homework,
Yes,
okay,
yes.
ma'am? And I'll do my homework. I'll have to do extensive research on that. I'll research and I'll do it. I'll invest time. I'll use my internet. I'll use my phone. I'll use electricity. So I'm investing more. And then I take my homework and I give it to Aman. Aman copies it and gives it to you. So he'll take.
Okay,
This
thank
is the
you.
difference between
Thank you
generic
so
drug and
much.
normal
Ma'am,
drug.
I have a question.
So you
between,
you are in
ma'am, can I
favor of
ask him?
using? Yes, who is speaking?
Ma'am, like, Priyesh, like, then what is the difference between the generic drug and the drugs which are prepared by the big corporate companies?
वही तो बोल रहे
is
हैं
there?
जो big corporate होती है ना, I mean the big corporate companies actually do research on these drugs. They are actually
Okay.
they go through a rigorous checks and all. They continuously do
So they are
research.
updated, you are trying to say,
They
as
are
comparable to.
updated meaning देखो, if someone is digging out and taking out gold, he is investing more energy na. And if someone is actually buying gold and selling it at some price, he is actually just buying and selling. He's just taking it a cost profit point.
Yes.
He's not
Yeah.
the making charges. You can
Yes.
go for the making charges. It's that point.
Okay.
So who else just wants to speak about this?
Picture.
Yes, that will do.
My point was already covered by Priyesh.
Yes, okay. And now there is a chart that shows there is a comparison of generic and brand name drugs here. As for active ingredient, there is no difference because they use the same ingredient as licensed by a brand name company, brand company. And as for the price, generic drugs are lower in cost, as Priyesh said. As for example, insurance coverage in the USA, so the insurance companies, they prefer they prefer their generic drugs because they are cheaper. And it is as for brand name, it is covered if no generic form exists. So surprise. And as for inactive ingredients, the brand name drugs are tested and approved by the agency. And as for generic drugs, they may differ, but also proven to be acceptable by the FDA. As for strength and dosage, there is no difference. And as for appearance, so the brand name drugs are standard in size, color, packaging, but generic drugs packaging and the drug itself may look different. It may look different. The package can be different, but so the active ingredient is the same, and so they have the same effect as the brand name. So this is the information about the generics in the United States of America. Maybe in other country, the information is different.
Ma'am, see, I have these two drugs with me. I mean,
Uh-huh.
these are multivitamins, ma'am. This one is a proper drug. It costs around 185 rupees for 10 tabs. I mean, these are omega oils and multivitamins. So this is the main drug, and this one is a generic drug, and it costs only 165 for 30 tablets. So what happens? Both the constituents are same. I purchased this at preliminary, and I use it, and later I purchased the counterpart, the generic part of this one. I was just for this. So you see, ma'am, 165 for 30 tablets and 180 for 10 tablets. This is these two.
I see. Yes.
Approximately same. When you look at the constituent label, they're same.
I see. Okay. Thank you so much. Well, so we've discussed this, and now if we go to the next slide here, there is information about patient care, and there are some guidelines for prescribing the drugs in the hospital. So let us look at these guidelines, and the question is why the guidelines are important and what might go wrong if we do not follow these guidelines. So let us listen to Aman. The first statement is for you.
Yes, ma'am.
Please.
Ma'am, there are guidelines for prescribing any drug in the hospital. Why these are important and what might go wrong if you do not follow them?
The first one is
always consult the BNF when prescribing for children. Consult your seniors when the doubt.
Please, Aman, can you comment on the first just guideline? Why is it important to follow?
Ma'am, because there are different doctors for the children. There are pediatricians for them. So we have to consult them. We have to consult the pediatricians for prescribing any medicine for, like, if the doctor is prescribing any medicine for children, then it should be a proper pediatrician. Pediatrics is a field of children.
Okay, and the dose for children should be lower than for adults, right?
Yes, ma'am.
Okay, thank you. So the next is for Apeksha. The second line, please.
Yes, ma'am. Consult your seniors when in doubt. For this, I would say that many times when the doctor, like what I say, like a second year, third year student is there who is not yet experienced so much in this field and is going for when a patient comes to him or her for the dosage of the medicine, then if he sees any confusion, then he should consult his seniors for that, because they have more experience in this field.
Exactly, yes. So anyway, so the medical work is just a teamwork. So that is why people should work in a team. Okay, the next is for Misha, please.
Yes, ma'am. The check if the patient has any allergic reactions to the drug. I think this is the most important because not all of the patients have say similar type, like they are not allergic. If the patient is allergic, then it would lead to life risking
Mhm.
disorders. So it is really very important to check whether he or she has an reaction, allergic reaction to the drugs,
I see.
whether
Okay.
it's for children or whether it's for adults.
Mhm.
It's important.
All right. Okay. So then let's listen to Nivas.
Ma'am, he is in the hospital, ma'am, for ultrasound, ma'am. He's facing some.
Oh, I
He'll
see.
be back, ma'am, in some
I
time.
see Nivas. Vandana, are you here?
Yes, ma'am. Good morning, ma'am.
Morning. So the line number
Ma'am, for my
guideline
question,
number four. Number four, please.
yes, ma'am. Check if the patient is a responsible person. Ma'am, it is very important to see if the patient is responsible or not.
Yes, Vandana. Vandana. Okay, who can comment on this? Can
Ma'am, may I?
Ma'am,
May
may
I?
I?
Vandana is here? Yes.
Ma'am, it was bad.
Ma'am,
Yes,
she's
ma'am.
facing technical issues, ma'am. Since
What
yesterday.
is responsible or not? Because they do affect when we take on time.
We can't hear you. Please just restart your computer, your device. So it's very.
Am I audible now?
Okay. So Priyesh, can you comment on this?
Yes,
Yeah.
ma'am.
Mhm.
Ma'am, we should check if the patient is a responsible person or not. Ma'am, whenever we are prescribing a drug, there are chances that we may prescribe a Schedule H drug or narcotics to someone. And if we are prescribing them, we need to be careful with them because H drugs, I mean, Schedule H drugs can cause different pathological harm to human body if they are given in excessive amounts. And narcotics are something which make inhibitant. I mean, patient get used to these if they and they are also euphoric. So there are chances that patient may start using them and using the drug as something which is not really good. I mean, in a disharmonial way. So a patient should be responsible. And ma'am, this DNF part, it is, ma'am, British National Formulary, and it is actually a journal. I mean, a set of rules and books where they keep up scales of different pharmaceutical data, and it actually helps them to differentiate between that. Yeah, this person is weighing 50 kilograms, so he should be given this drug and into this amount. He is weighing 100 kilograms, so he should be given this drug. So this was the point. Ma'am, should I explain fifth one also, which was my question?
Okay.
Ma'am,
So,
for the point
yes.
that Priyesh said, there is one more point which can be added.
Mhm.
That is, we should check if the patient is responsible or not. Is like whether that person is having the responsibility to take the drugs on time or not. Like many people have issues with taking medicines like pills, and they prefer taking cough syrups. So that should be taken into considerations while giving the prescription.
Okay, thank you. And the Rakhav, are you here? Rakhav? No, Rakhav?
No.
Ujjwal?
Yes, ma'am.
So please, the fifth guideline is for you. Can you comment on the fifth line?
Yes, ma'am. The check for alternative to drugs, ma'am. But the point represents when the patient was come for a treatment or its responsibility has to become. We have to closely check that what type of drug he has to take, and because sometime a particular drug is being allergen to the patient, and so that we have always have to take an alternative in that form. Either it was a type of the pill form or it was a curve form. We can take an example like the paracetamol. Sometime a patient has to be not too good for that patient. They has some type of allergens on them. So in that case, we take an alternative like the ibuprofen, which also has a part for not just for the pain, it also helps in the treatment of fever, which is a type of the paracetamol. So it acts as an alternative for the patient. And also we can take an also an example like sometimes the patients have uh, sometimes patient have a swallow problem, so it does not take a pill. In that case, he can take a syrup. It was also act an alternative. These are the
Okay.
some form which we can understand.
Okay, I see. But are there any alternatives to drugs? I mean, instead of drugs, what can be just what can a doctor recommend to a patient instead of drugs?
Ma'am, instead of drugs, he can use the medication process. Like the medication he can use, not just for drugs, he can use medication.
Or can a doctor recommend to change the lifestyle, to stop smoking, for example, to start doing some
Yes, ma'am.
physical exercises and to change the diet, right? So
Yes,
as the alternative to drugs. Mhm. Okay, good.
Yes.
Thank you. And so here is the information about abbreviations. So these are common prescription abbreviations that are commonly used. And if we have a look, there are two columns to the in the left-hand column. There are abbreviations, and we should match them with the definitions, with the meanings which are given to the right head, to the right. And if we have a look at the first abbreviation, which shows PO, just many of the abbreviations, they just show us these letters stand for some Latin phrase. And this Latin phrase is per os, which means by mouth, orally. Now, please have a look at the other abbreviations, and I'll give you a couple of minutes, 2 minutes, just
PRN is ma'am, it is
Ma'am,
Just a
as
PRN
minute.
is
required.
like as required.
minute.
As
Let us
required.
do it individually. Everyone should have a
Okay.
chance to think about this. So please do it individually. Take notes, and then we'll check together. Okay. 2 minutes.
Ma'am, should I fill this table? PO mouth. PRN as required. That. OD. Right. And G. TT.
Okay, let us check and let us ask Sayunika to comment on this task. Sayunika, hello, are you here? Sayunika? No, Sayunika. Rohit, please. Rohit?
Yes, ma'am. Ma'am, the PRN ma'am stand for ma'am proprinata. Ma'am, that's mean ma'am. Yes, ma'am.
Yes, yes. Continue, please. And
Yes,
what
ma'am.
does it mean?
Ma'am, which means that the administration of medication is not scheduled, ma'am.
So we have just the letters from A to G. What does it mean? Which letter should we connect this? Prorenata means
Ma'am, G one.
G as required.
F as required, yes, ma'am.
As required, this is F, yes? Okay.
Yes, ma'am.
Rohit, what about the other abbreviations? STUT,
Ma'am, stat ma'am is for ma'am urgent or ma'am immediately.
immediately.
Ma'am D
Okay.
immediately.
Okay. Then the next, Rohit.
OD ma'am.
Yes, OD. So OD stands for the Latin.
Ma'am daily.
Yes,
Right.
Latin phrase omni die, which means omni
Every
Once a
morning.
day.
once
every
a
morning.
day.
Once a day.
Once a day.
Omni,
You're right.
yes, ma'am.
Once a
Once
day.
a day.
Then
Once
G
a day.
stands for
Gram.
gram. Yes. TT
2 tablets.
2 tablets.
Two tablets.
and OM.
In the morning.
Omni
In the
main,
morning.
ma'am, one in the
Every
ma'am,
morning.
in the morning.
Every
Omni main.
morning.
Omni
Omni
mane.
main.
Latin. This is in the morning. Yes, you're
Yes,
right.
ma'am.
Okay.
Oxoclonus, myoclonus.
Mhm. And if we move to the next slide, we have more abbreviations. So we do understand
Omni nocte.
OE, which means omni dia, or once
Right.
a day, and
Right eye. Right eye, ma'am. Dean. Right. Omni
omni
eye.
mane in the morning. Yes, and so here there are more abbreviations.
Latin,
Grouped.
no, ma'am.
Just a minute. They are grouped in 3 groups, like the frequency, how frequent the drugs should be taken, then the route of administration. So, and the group of abbreviations for measurements, how much of the drug the patient should take. Now, please, also 3 minutes to you to do this task, to write the meaning of this abbreviation, please. Do it individually.
IVIM.
Okay, let us check what we've done. So let us listen to Ritik to comment on the abbreviations about frequency of drugs. Ritik, please. Is Ritik here? Hi, guys. Are you here?
Yes, ma'am.
Yes,
Yes,
please.
ma'am.
Yes, Ritik, please. ON, what does it mean?
Ritik, you're not audible.
Can't hear you. Okay, so some problems. Just let us listen to Vandana, please. Vandana?
Yes, ma'am. Am I audible now?
Yes, can you speak?
Yes, ma'am. Ma'am, ON stands for once a day.
Yes, then all the group of frequency drug.
Yeah, BD stands for 2 days is 4 times a day, and 4 to 6 are it is showing the gap of it is showing the interval of dosage of medicine. 4 to 6 hour gap should be given between 2 dosages, and 8 hours is hours between 2 dosages, and 1 to 4 hours is again the interval of dosage.
Yes, every 1 4 hour. Okay, so we need
Yes.
to stop